Hello, this is Dr. Lena Edwards, and today I am talking to the lovely Sarah, who is absolutely way more beautiful in person than even in pictures. So anyway, Sarah has a very interesting story that she would like to share, and I thank you very, very much for offering to share your story with other women so that you can hopefully help them in their journeys towards finding better health. So thank you again so much for agreeing to do this interview with me. So Sarah, if we could, where I'd like to start is if you could just give the viewers a brief background of sort of what your medical journey has been. I know it's really complicated, but just sort of briefly where you sort of started and what sort of journey that you'd experienced prior to you and I crossing paths.
Well, it started probably about 10 years ago, and I found myself in a nursing position and completely exhausted and overwhelmed with this anxious feeling. And I was like, there's no reason for me to be anxious. I don't have sick children. I don't have, my job is good. I love the people I work with. And so I went to the doctor, and it was just this overwhelming tiredness, anxious, can't get my breath. I couldn't get rested. I was just overwhelmed with life and found myself sitting in my living room just staring at the wall, praying, God, do something. I don't know what to do. And, I was struggling with libido. I was not who I had been. And I just hit a wall.
Mm-hmm. And how many different people did you see to try to help you with what was going on with you?
I saw 8 different doctors over the course of the years, just constantly going to someone new, being sent to a specialist, being, pawned off to the next one to see if they could help. And everybody came to the same thing. Oh, you have generalized anxiety disorder. And I was like, well, why is that? I'm not anxious. And they never had answers. They just wanted to give me a medication to make it better. And it didn't work.
Mm-hmm. And how many different... Go ahead, I'm sorry.
Go ahead. I just finally found that the more doctors I went to, the more they tried, and they would max out one system, one type of medication, and then go above the federally recommended dose, take me off of that one, then put me on another one. And I was just on this roller coaster where I was like, I just want to die. And I ended up just for months in bed doing nothing because I couldn't function.
Mm-hmm. And was there anything going on at the time that was sort of fueling this? Or was this just sort of, like you said, there's really no reason for it to be there. It's just there and nobody can really figure out what's causing it or fix it.
Right. There was really nothing that we could pinpoint. There was no outside reason that I should be having these symptoms.
Okay.
And in the midst of it all, I did find out that I was in menopause.
Mm-hmm.
But before I didn't even know I was in menopause, I was completely through it. So I was like, oh, maybe that's what's causing it. But, several years after completion of menopause, I'm still in the same place.
Mm-hmm. And did it start before you went into menopause, or did it start after?
It started before.
Mm-hmm.
I didn't know that I was really, like I said, I didn't have hot flashes, and I knew that, my periods were getting a little irregular. And so I'm called and I said, that's why I'm anxious. Is there something you recommend? Like, well, no, I don't know about that. What I do know is I can come back. Let's do some hormones. And I found out that you may never have a cycle, your hormone levels, that you're completely through menopause. But that was like an overnight thing.
So did they ever do any kind of testing to try to figure out what was causing your symptoms, or were they just primarily trying different prescription medications?
No, they never did any testing. Now, I guess I can say they did do some blood work and tested my thyroid, and they kept telling me, oh, your thyroid's like borderline, but we'll just keep watching that. But never came up with any concrete answer. They were just treating symptoms. They figured out what was causing it.
So how were you able to, or what did it take for you to sort of break out of that, the situation where you were in, where you'd seen all these different providers and nobody was able to help you? Uh, Sort of what happened to make you go in a different direction?
I was just at a loss. I was in bed. Everything that went around wasn't even going around. I caught it, came down with it. And one of my friends suggested, why don't you check out Dr. Lena Edwards? I just think maybe she can. And so that's what I did, because I had exhausted everything. I had been to a sleep doctor. I had been to, psychiatrist. I had been to gynecologists. I'd been to my doctors. Nobody had answers for me. And so when they suggested Dr. Edwards, I said, okay, I've got to know what's going on here. After just the first time, I knew that you figure out what the underlying cause of all of this.
How easy is it for you? I find this is a really major issue for a lot of patients, that they don't know where to look, or they don't have physicians in their areas that are able to help them. Did you have that same experience?
Yes, I actually tried a nurse midwife to see if she might be able to, after I worked with her, this is what's on with me. They're, doing antidepressants. Do you think, that it could be hormonal? And she said, well, let's just try, and she didn't know what she was doing. So I was given the wrong amount of hormones, which caused me to have postmenopausal bleeding, have to go through more tests, more issues. So, I felt like there had to be something underlying, but I couldn't find anyone who could address it.
Mm-hmm. Mm-hmm. Yeah, I find that that's a very common problem, that a lot of women that I've worked with and that are in the group, they can't find anybody. And then even if they try to look for somebody who is supposed to have training or know how to look for things a little bit more comprehensively, things don't always turn out the way that that's expected. So that's been another problem. So obviously, you and I worked together, and we don't have to get into the details. Everybody's different, obviously, but can you just basically give an overview of sort of what was different about this particular process for you that helped you to transition and get to where you are now?
Well, just right from the beginning, just starting out with, let's figure out what's going on here, and taking the time to eliminate things, add things. Let's just see what's going on. That was just amazing. And it didn't take that long of a time, because you took the time to just focus on, okay, let's figure out what the underlying cause is here. And it was simple. It felt like, that things were done easily, and I couldn't believe within the amount, it didn't seem like it was very long, and I was like, I feel so much better. I told my husband, I said, I'm laughing again. And I hadn't been able to do that for so long, mm-hmm. that I just said, this is something that I will never forget, that has changed my life, and just something that is a huge blessing. I can't even explain just finding out what the root cause was. And it wasn't, just having a doctor who actually figured out what the cause is, instead of just walking in and saying, oh, okay, well, this is what's going on. I don't see anything in your blood work, so take this pill, you'll get better. It didn't work that way.
Yeah. And you're a nurse. You've been around a lot of doctors, not necessarily just as a patient, but in a professional setting.
Yeah, exactly. And that's what, I was going to the doctors I was working with and saying, what do you think? What could this, be causing this? And they were at the same loss. It felt like they didn't know how to get the right blood work or to do the right thing that needed to be done.
Right.
And I think that my primary care doctor, when I go back and see her now, she's just like, I think she's blown away that I was turned around and a totally different person, the person that she knew a long time ago.
Mm-hmm.
And it, you know, this, she has nothing to say other than, you know, she says if Dr. Edwards is taking care of, you know, blood work and things like that, that's fine, to send it through me and I'll work through her. She doesn't, which I'm very thankful for that.
Mm-hmm. Yeah.
Because she sees that there's a value there.
Right. That's right. So, well, one of the things that we did figure out that it wasn't a prescription drug deficiency that was causing the problem, right? So,
Yeah.
what, I guess if you just give an overview of like what happened with your prescription medicines as we were working towards, you know, correcting the underlying cause.
Yes, it was just so amazing to me. I think when we were able to take away those prescriptions and figured out that I felt so much better without the prescription and with the correct nutrition and things that I needed, it was like, wow, you know, and so now I'm not really taking prescriptions. I'm almost completely off of them. So I feel better. I could tell the difference once I went off of the prescription. That's when I just looked at my husband. I was like, I can laugh again. It's not like my whole body is subdued. And
Right.
It really was.
Right. And I think another thing when we first spoke, you weren't even able to work when we first were speaking, right? You had to stop working. Talk a little bit about that and where you are now.
I came to the point where I couldn't even get out of bed. So I had to just put in my notice and depend on that I was going to get through this somehow. I didn't know. I didn't think I'd ever return to work. And after working with Dr. Edwards for probably 6 weeks, I said to my husband, I need to get a job. And I started part-time, and I did that for a few months. And then now I'm back to full-time, and I'm happy. Like, I couldn't sit at home like I did before.
Mm-hmm.
It's like I go and do something. And I'm just so thankful to be able to get out there and work with people again and be able to say, you know what, I know where you're coming from, and there's an answer to this, and so let's get you some help. Mm-hmm. It's rewarding to be able to do that.
Do you feel like you've learned some things that allow you to even help other women?
Oh, yeah, definitely. It's amazing when I meet people and they have symptoms and things going on, to be able to say, oh, there is hope. You know, you can get better. Mm-hmm. Don't lose hope here, because I almost did. I seriously felt like death would be better for me. And to find life again is just wonderful.
And you just celebrated a wedding in your family, and you were able to fit into your dress that you were looking forward to getting. You were saying it was absolutely beautiful, the pictures that you
yes.
put.
I lost 20 pounds, and that was without even exercise, because I could not exercise. And, you know, now that I'm better, I'm able to get out and walk, and it's just I didn't work, what you want to say, work and exercise and exhaust myself to get in that dress, but it was just having the right combination of what my body needed. That weight came off, I felt better, and I feel 100% better because I fit in my clothes again. And it's just amazing what the right combination of nutrition and what your body needs can change you.
Right. Well, and one of the things I wanted to point out also is it's not just important to have the right physician that you're working with. It wasn't easy. You know, there are things that you had to do that might not have been particularly easy for you. And I think that I wanted you to speak to that a little bit, as far as, you know, what it takes on behalf of the person seeking help to get better. Because it isn't just as easy as you sitting there and me just saying, take this, do this.
Yes, definitely. I was determined. It wasn't, you know, like you said, easy, but I was determined that whatever it took, I was going to follow it and do my best, because if this is going to make me better, then that's what I needed to do. And so that's what I did. I stuck to it. I thought, this is nothing compared to what I've been through in 10 years. Some changes in my diet, some things that I don't eat for a while, that's okay.
Right.
And it was worth every bit of, determination to do it.
Mm-hmm. Well, you did really, really well. But I think that that's really important, because there's so many women out there that feel so poorly. And one of the major problems is they can't find anybody to help them. But I think equally concerning sometimes is they find somebody perhaps, but then they aren't able to do what they need to do to also participate in getting better. So I think it really is a co-partnership, if you will. And I think that part of it's really important too. So
just having you to support me along the way. Dr. Edwards was just amazing in her patience, and I didn't feel that it had to be something that made me so sick I couldn't go through it. It wasn't anything like that. It was just that encouragement that, if we do this, this is where we're going to be. And it was worth it.
Mm-hmm. Well, I'm just thrilled sitting here watching you compared to when we first spoke 4 or 5 months ago. It's incredible difference.
Yes.
So I guess in closing, one of the things I usually will ask women that I'm speaking to do is to give the women viewers that are watching this some piece of advice that you think can help get them to the place where they need to be to feel better.
Just don't give up. Find someone who can find the underlying cause for you, and don't give up on the plan. It's not going to be easy right in the beginning, but you will see results so much faster than you can imagine. And just don't give up. Find someone who can find out what's really going on with your body.
Mm-hmm. Wonderful. Thank you so much, Sara. Your story is really heartfelt and really genuine, and it's really people like you and seeing what you're capable of doing to help patients. It's the reason why I do what I do, and I'm sure it's why other physicians do what they do. So thank you so much for sharing your story, and I'm sure it will inspire other women to take action and be done with the way of insanity of doing things the same way and not having it work. So thank you again so much. I really appreciate your time, and I'll be talking with you very soon.
Okay, thank you so much.
Absolutely.